Hello, everyone. My name is Kendra Chandler, and I will be presenting my research titled Emotional Abuse, Neglect, and Mental Health Investigating Dissociation and Depression in Communities of Color. My research advisor is Dr. Ryan Couillo, and we are representing Georgia Southern University. Thank you so much for engaging with my research today. So, just some background information. Childhood emotional maltreatment, which is psychological abuse or neglect, is regarded as a caretaker's inhibition of a child's psychological development, failure to meet a child's emotional needs, and or the lack of demonstration that a child is loved. It can also convey to a child that they are worthless, defective, damaged, unwanted, or endangered. Emotional maltreatment is considered a form of adverse childhood experiences, which includes incidences of abuse such as physical, sexual, or emotional abuse, neglect such as physical or emotional neglect, and household challenges, including substance abuse in a household, mental illnesses in a household, parental separation or divorce, incarceration of a household member, or witnessing violence. Although emotional maltreatment is the most common form of childhood emotional experiences, it is the least researched and least recognized form of maltreatment. But many studies have demonstrated the severe consequences of childhood emotional abuse and neglect, such as depression, suicide, and risk, which can also include substance and alcohol use. Additionally, emotional maltreatment can increase an individual's risk of experiencing dissociative symptoms, which may manifest as a coping mechanism for individuals who experience trauma. Social determinants of health, including poverty, disproportionately impact marginalized communities such as Black populations, which furthers their risk for experiencing more adverse childhood experiences and increase their risk of psychological distress. Even though there are pervasive outcomes in these communities, there are still gaps in the literature as it pertains to emotional abuse and neglect in BIPOC populations, which are Black, Indigenous, and people of color. So, the purpose of my study was to examine how reported experiences of childhood emotional trauma relates to adult mental health outcomes, specifically dissociation and depression in BIPOC communities. So, we hypothesized that BIPOC individuals with histories of psychological maltreatment will endorse less adaptive mental health, just meaning that they will endorse symptomology of depression and dissociation. So, to gather data, we collected information from 122 participants with a mean age of around 20 years old, and they were recruited from Georgia Southern University SONUS system, which is a data recruitment system where individuals who are enrolled in psychological courses such as Introduction to Psychology or research methods can participate in research. So, some measures that we utilize to gather information was the maltreatment and abuse chronology of exposure, or the MACE scale. And this is a 32 item self report that assesses 10 forms of maltreatment. However, we only utilized the emotional abuse and nonverbal emotional abuse subscales. We also utilize the trauma symptom checklist, which is a 40-item self-report trauma questionnaire that assesses trauma symptomology over the past month. However, the only subscales that were utilized were dissociation and depression, and we also administered a demographics questionnaire, which just assessed basic demographic questions such as age, gender, sex, race, ethnicity, major, rurality, first language, marital status, and dependence. So, regarding the demographics, we had one individual who identified as a gender, one who 25 who identified as cisgender men, 90 who identified as cisgender women. We had one individual who identified as genderqueer or gender fluid, one binary individual, one who labeled themselves as another, two individuals who identified as having two or more genders, and one preferred not to respond. In terms of ethnicity and race, majority of the participants were African American or Black. We had 34 participants in that ethnicity and race category. Excuse me. We also had 4 participants who identified as Asian or Asian American, 58 who identified as biracial, 14 multiracial, 1 Native Hawaiian or Pacific Islander, 1 who identified as other, and then we also had 10 Hispanic participants. We had 14 participants who were from rural populations, 40 from small towns, 29 from small cities or metropolitan areas, 38 from urban or metropolitan areas, and 1 was missing data. Regarding our results and conclusions, so we utilized multiple regressions to determine if there would be a significant interaction between childhood emotional maltreatment and depression, as well as childhood emotional abuse and neglect and dissociation in BIPOC populations. And we found that adult mental health outcomes were significantly predicted by childhood emotional abuse and neglect. Although they were both significant, dissociation did demonstrate a stronger correlation with childhood emotional maltreatment. So this confirmed our hypothesis that BIPOC populations do endorse negative mental health symptomology when experiencing negative childhood events, including psychological maltreatment. So this just highlights that scholars, researchers, mental health practitioners should, one, assess BIPOC individuals for these traumatic experiences and just focus more on how these events may differ from other populations. There are pervasive outcomes compared to other populations. So it should highlight the need for more focus and attention in this area. This research has some limitations. For example, just using retrospective self-report data, there could be bias in participant responding. It doesn't mean that their biases are intentional. It can just be that as time passes by, their memory recall may be impacted. Additionally, we could have used a larger sample size, which would have highlighted more data and significance, and then also just some limitations on sexual identity. So we did not determine if the individuals who participated in the study identify as straight, gay, or any member of the LGBTQ community. And LGBTQ community does experience adverse childhood events, and the impact of those events are extremely pervasive. So in a future study, we can ensure that we will include sexual identities. Thank you so much for engaging with my research. I hope you all enjoyed reading about how emotional maltreatment influences mental health outcomes in the BIPOC community. Be well and take care. And all the information is located below. My email is kw24715@georgiasouthern.edu, and Dr. Ryan Couillo's email is rcouillo@georgiasouthern.edu.